Welcome to this seminar. We have Dr. Gina Dado with us today to talk women's health. Thanks for being here, Dr. Dado. Let's go ahead and get started with the questions. As women, we often put everything before our own health, but what does an annual visit entail and what makes it so important, Dr. Dado?
Well, we as women tend to be nurturers, and so in order for us to care for people that we love and our families, we need to take care of ourselves first, because if you don't have your health, that can be a really rough go for everybody. So we recommend, coming in for your preventative wellness checks. We do full history, physical, find out if you have any abnormal symptoms. We refill birth control pills, hormones. You do STD testing, and just making sure that everything is working the way it should be.
And I would imagine even right now, more people are putting that annual visit off even more with COVID. So what is your clinic doing to keep patients safe?
That's a great question. We all are masked. We are doing minimizing how many visitors are able to come with patients so that there's just less exposure. And we do try to social distance as much as we can during the exam.
All right. So bottom line, women, do not put off those annual visits. They're so important, right, Dr. Dado?
Absolutely. In the beginning when this COVID hit, I think it was, reasonable for people who especially were high risk to put things off for, maybe a few weeks, a few months. But now that we're well underway with this and it looks like this is going to be with us for a while, now is really time to get all of your wellness checks, see your doctors. If you have, different problems that you've been kind of putting off, come in and we'll take care of you and make sure that you're doing okay.
Such a great and important message. Well, shifting now to the topic of maternity, is it safe right now to get pregnant?
That's probably an individual family choice. Certainly, we do everything we can on our end to make sure that moms and babies stay healthy, and we will obviously take care of you if you do get COVID, and the risk is low that the COVID would go from an infected mom to a baby, and basically doing all healthy measures to eat healthy, get your rest, take some vitamin C, vitamin D. That's all going to help prevent you from getting sick and, be great for, your health. And if you decide to have a baby, also good for the pregnancy.
So for those pregnant moms out there, what sort of precautions should they be taking right now?
It's really the precautions that we're all taking, which is stay away from indoor crowded places, mask up, wash your hands, and kind of more stay at home at this point in time. That's the recommendation, to be healthy and to decrease our risk of exposures. When you're outside, it seems to have less risk. And so, if you need to get out, get some fresh air, but not around people. And here in beautiful Idaho, we've got all the seasons, so you can do something to uplift, but not put yourself at risk.
Yeah, that's a great point. Lots to do outside for sure, and still stay safe. Well, back to the care for all of your patients. What is the number one question you're getting from patients right now?
It's mostly, do I come in? Do I come in to get my checks? Is it safe for me to come in to see the doctor? Questions about pregnancy, probably, but it's just all the normal questions that people have. But now with COVID, everything has got that COVID spin. Is it okay, with the risk of COVID coming in and getting pregnant, and like we talked about? That's pretty much the questions. We here at West Valley OBGYN really take pride in caring for patients. It's something that I truly feel very proud of, that, and I think now, especially in this area of, or time of COVID, people need that TLC now, and we're good listeners. You know, our job as OBGYN providers is not only just to make the body healthy, but also I think our patients leave in a better spirit, feeling happier, feeling like they're well cared for, and I think that goes a long way in this time of high anxiety and concern for, you know, the world. So I think that's something that we've been doing here that's, I think, a little special.
Well, it's interesting that you mentioned that. So part of our self-care is making sure that we're putting our health appointments at the forefront, right?
Yeah, for sure. They say you can't, you know, keep giving if your well is dry. You have to actually recharge your battery in order to be able to take care of those around you. So it really does, you know, even on the airplane, what do they say? Put on your mask before you put on the oxygen mask for your little one. It's the same kind of thing. We all have to really take care of ourselves, and then others will follow.
Yeah, that is such a good reminder. Well, Dr. Dado, welcome to the team. Tell us something about you as a physician and why you chose this field.
Well, I really like the diversity in OBGYN. In one day, I can see teenagers to older patients to pregnant patients, you know, fixing, you know, pain and bleeding and doing birth control refills and maybe doing a surgery versus delivering a new life. You know, I mean, what better career is there? You know, I feel very honored to be able to do OBGYN and honored to be at this wonderful HCA facility.
Yeah, why did you choose this particular group at West Valley?
You know, that is a good question. I came and was not interested at first in working here. And I literally came, interviewed, and just fell in love with the people. And honestly, the people make this hospital and office. I can honestly say I've worked in a variety of different places, and this by far has been the most caring and, you know, treating physicians with respect and their patients. And it's all about care. They all put care back into healthcare, which is something that I, you know, pride myself on. I like to feel that my patients feel like they're being cared for, and I treat them as if how I want to be treated. And I think that that's the mindset of all the people that I work with here.
Dr. Dado, this has been great to get to know you, and that reminder that self-care is the best care. Is there anything else you'd like to add?
Come see us here at West Valley. We're a great group. We have lots of a wonderful care that we can deliver, from be it gynecologic, be taking care of, you know, bleeding abnormalities, just normal wellness, birth control pill and hormone contraceptive management, hormone management, to, you know, the maternity and obstetric care of low and high risk pregnancies. And so we're very excited to see everyone who walks through our doors.
Yes, and I do want to let our viewers know that we have taken every safety precaution and we put that in place. And that includes moving our childbirth tours and our childbirth prep classes and breastfeeding classes online. And our instructors are actually getting tremendous feedback about this. It's really still a personalized experience online, that virtual experience. So that's been really great for our instructors, and it's a safe environment for our maternity patients as well. So thank you so much, Dr. Dado, for joining us, and for our viewers online, thank you for being here. If you would like more information, you can always go to westvalleyisbetter.com. Have a great day.